everyone, and welcome back to Just What Can a GP Do? My name is Dr. Baptiste and I work as a portfolio GP. I post videos all about general practice, portfolio careers, remote working options for GPs and much more. If you like this video, then give it a thumbs up and consider subscribing and sharing the video with a friend. In this video, we'll be hearing from Dr. Adam Smith. Dr. Smith is a GP and lifestyle medicine physician, a coach for doctors and director of LifeMed Community, the online community for lifestyle medicine professionals. He has worked in occupational medicine, which sparked his interest for improving the health of medical professionals. This in turn has led to an interest in lifestyle medicine. Dr. Smith is an associate with the British Society of Lifestyle Medicine and is an assessor for their core accreditation qualification. He is passionate about lifestyle medicine and its power to transform the health and well-being of both doctors and patients, and believes lifestyle medicine offers exciting career opportunities for medics both in the NHS and privately. LifeMed Community is the online community for doctors interested in lifestyle medicine. It has weekly CPD approved interactive live sessions featuring expert guest speakers and covering themes including business development, coaching skills, clinical case discussions, lifestyle medicine topics. There is a supportive community forum designed to help members thrive both personally and professionally. You can use the code Baptiste for a 50% discount on the standard annual membership price. So go check out the website, it will be in the description box below this video, and I'll also add the social media handles too. So let's get into the video.
Just want to start by saying thank you to Dr. Baptiste for inviting me to talk. It's a pleasure to be able to speak to you, and a brilliant series. What can GPs do? I mean, being a GP has been such a privilege. Of all the medical specialties, it's one that really gives opportunity to tailor your career to what interests you. And that's what I've done over the years that I'll talk a little bit more about. So I've been a GP for 17, 18 years, and I've had a number of roles over this time period, which has brought me to where I am now as a GP and a lifestyle medicine physician, which I'll talk more about. So I've been a GP partner at a busy practice in the urban West Midlands, and also a GP partner at a rural small practice in the Scottish Highlands. I've been a salaried GP, locum GP, and a private GP. So I've done a fair bit of GP. Outside of general practice, I've been a GP tutor for medical students and clinical senior lecturer for medical school. I took the diploma in occupational medicine many years ago. Now I've worked as an occupational medicine doctor for an NHS trust, and that was a role that really got me interested in practitioner well-being and how it's so important that we as clinicians and health professionals are in good health in order to care for our patients. A couple of other roles, I've been a military medical examiner and a doctor for a Scottish Premiership football club. But what I'm enthusiastic about is lifestyle medicine. And I qualified in lifestyle medicine in 2020, 21, which makes me a lifestyle medicine physician. And since qualifying, I've become an associate with the British Society of Lifestyle Medicine, the BSLM. And I've been a tutor, a study group leader for them. And I'm currently the interim lead assessor for the BSLM's core accreditation, which is their qualification in lifestyle medicine. In addition to this, I'm also a business director, so I'm a co-founder of LifeMed Community, which is the online community for doctors, health professionals and coaches who are interested in lifestyle medicine. So whether they're practicing, taking the qualification, or at the start of their journey, just interested in what it is and how it can help them personally and professionally. So we have weekly online sessions that are friendly, interactive, and we talk about a range of topics related to lifestyle medicine. So should probably talk a little bit about what lifestyle medicine is. It's a relatively new specialty currently, which is gaining a lot of ground, a lot of interest year on year amongst doctors, other allied health professionals as well. It's essentially it's a branch of medicine that uses evidence-based lifestyle interventions to help people improve their health and their well-being. and it can be used to prevent, manage, and reverse a number of long-term chronic diseases. Something that looks to identify and address underlying root causes for symptoms and takes a holistic approach, treating the person or the patient and not just the symptoms. And for me, I believe it's about providing hope, kindness, and support for individuals free from blame or judgment. So it's more about empowerment. So we've all got control over what we do with our lives and the choices that we make. And for some people, healthy choices are much easier to make than others for a range of factors. So I believe lifestyle medicine is more about an individualized approach, and coaching plays a big role here as well. So it's about helping people realize the control they do have in their lives, to clarify their individual priorities in life, which are not driven by societal, cultural upbringing or other factors, and to help them achieve their goals, including their health goals, through sort of kindness, behavioral change support, and access to the right information. So lifestyle medicine isn't in place of conventional medicine. It's very much an adjunct to it. I think there's a couple of quotes that, for me, say a lot about what lifestyle medicine is. And there's one by Desmond Tutu: "We need to stop just pulling people out of the river. We need to go upstream and find out why they're falling in." And there's another quote by Michael Marmot, who, in his 2015 book Health Gap, starts with the line, "What good does it do to treat people and then send them back to the conditions that made them sick?" So these are kind of the upstream causes of symptoms, the root causes. And so this is what the essence of lifestyle medicine is about. It's about these upstream causes, what are called the socio-economic determinants of health, behavior change approaches, and the 6 pillars of lifestyle medicine, which look at physical activity, nutrition, sleep, social connectedness, avoidance of harmful behaviors, and stress management. And I'll tell you a bit about how I got into lifestyle medicine, but also why I think it's important and why we need it as well. I think particularly now we need lifestyle medicine. There's increasing burden of chronic disease and also burnout, stress amongst health professionals as well. And I believe lifestyle medicine is beneficial for both health professionals and patients. Most GP consultations are related to lifestyle factors, and there are so many opinions and influences out there as well where our patients get their information from. So we need to also make sure this information that's out there is correct. So I think we really do need lifestyle medicine at the moment, so I'm very much an advocate for it. I got started in lifestyle medicine a while back now. I almost fell into it by accident. I had personal and professional reasons for getting involved with it. I empathise with the quotes or the image that you put your own oxygen mask on first. And I think as health professionals, we need to really be looking after our own health and well-being in order to look after that of our patients as well. So my journey to lifestyle medicine came at a time when I was looking to improve my own health, and at the same time I was also professionally becoming quite frustrated in my GP work. I felt I was treating symptoms rather than people and not getting to the root causes of people's issues. So it felt very much like firefighting, again, like going back to that Michael Marmot quote, treating people, sending them back to the conditions that made them sick, and often see the similar faces coming back with similar issues. And personally, I was at a point in time when I was conscious that my own health could be improved. I wouldn't say that I was going through burnout, but there were a few warning signs there. So I started to research what small changes I could introduce into my own lifestyle that could help me improve my own health. And I found these small things I could do and fit in. So I started like 10 minutes mindfulness practice using an app. Found some small benefit from that. Started to look at exercise. So I walked more, drove less, got involved with team sports, helped with exercise as well as like the social aspect of it. I looked at prioritizing my sleep, but essentially bit by bit over time, I found that my own health and well-being improved, and that ultimately led me to being noticing that I was being a better doctor as well. I was having these conversations with patients that I found the benefits in my own life was also having effects on my patients' lives as well, or that I could pass that information on to them and speak to them from a point of experience as well. But all of this ultimately led me to lifestyle medicine, and I decided to do the qualification in lifestyle medicine through the BSLM back in 2020, and since then become a lifestyle medicine physician, and I've got very much involved with BSLM and looking to promote and encourage people to engage with this specialty as well. And it's something that has this amazing ripple effect. It's a common theme that stands out for me that I've experienced, as have many others I've spoken to, is that when I've learned about and implemented lifestyle medicine principles, my own health and well-being has improved, as has that of my patients and clients. And the benefits have also spread to my family, friends as well. And I've had patients say that their friends and family have also benefited from the interventions and the discussions also. And one of the benefits I get as an assessor for the BSLM's accreditation is that I get to read case studies and self-reflections and real-life examples of how lifestyle medicine is making a huge impact in the lives of patients and professionals, and it's very inspiring. So there are challenges, there are these factors that make it difficult for some individuals to make healthy choices, but at the level of the individual, we can make a huge difference. I guess top tips or advice for getting into lifestyle medicine, if you're considering this, there's a number of things you can do with lifestyle medicine. It's something that can be implemented in both the NHS and privately as well. So in the NHS, there's a number of methods or ways of introducing lifestyle medicine strategies into your consulting when you're seeing patients in daily general practice. There are other initiatives that people are setting up, such as group consultations, for example, looking at taking certain groups of patients, whether it's pre-diabetics, for example, and running sessions as a group, with them looking at teaching and supporting through lifestyle. There's a number of private options available as well. It is a specialty that's very much in its infancy at the moment, so people are kind of treading the water and seeing what works and what is available. Coaching is a very common and popular specialty or area that people are professionals, doctors, GPs in particular, are going into, and sort of private coaching is a common option that more and more people are looking to go into for personal fulfillment. So a number of things you can do with it. To start off, I would say start with why. There's a brilliant book by Simon Sinek, Start With Why, which I'd recommend to anyone. What's your motivation for getting into lifestyle medicine? Get really clear on this. Is it for greater satisfaction at work with your patients? Is it improving your own health well-being? Do you have entrepreneurial motivations? Are you interested in coaching? To really get clear on why you're looking to do what you're wanting to do, and that can really help to set your kind of North Star, as it were, and help you to achieve what you set out to. So follow your interests, follow your values, and by doing this, it just makes sure that when you, for another analogy, so when you do climb the top of that ladder, you're doing all the work, you make sure that the ladder you've climbed has been propped up against the right wall. So the other tip would be start learning about it. There's lots of information out there about lifestyle medicine, and when I started to research and learn about it, I looked online, read books, listened to podcasts. It's important that we know the information that we're getting is reliable. And a lot of this is where lifestyle medicine comes in as well, that we need more trustworthy resources that are out there for health information. But I would recommend the BSLM website as a good place to go to for resources for lifestyle medicine. There's a lot of links on there as well, and you'll find information about the kind of the knowledge side of things, as well as like practical suggestions and next steps, how to go about implementing it yourself. Listen to podcasts. Ones that I've listened to in the past would include Rangan Chatterjee's Feel Better, Live More. So he's very much an advocate for lifestyle medicine, and his podcast is excellent. Microbiome Medics, I would say, is another very good podcast, which has recently started. Speak to people who've done it. Very happy to answer any questions. Feel free to reach out to me as well. And look out for any lifestyle medicine events that are going on locally. The BSLM has an annual conference, which is always a great place to meet people, speak to people, network, as well as learn the latest research and how to implement it, and also how to get lifestyle medicine in practice. The third tip would be reach out to people who are doing it. So it can be isolating doing something different and approaching medicine from a different angle and applying it to yourself. And that's why I set up LifeMed Community as well with my colleague. It's to be surrounded by like-minded people who are on a similar journey. So yeah, find a community. I'd say see who is around your local area who's interested in lifestyle medicine. Are there any groups nearby geographically? There are lifestyle medicine Facebook groups. Social media can be a good way to find and connect with people, and I think connecting with people who are on a similar journey is very important. So in summary, I'd highly recommend lifestyle medicine because I think it is essential for the future of healthcare. I think it's good for both doctors and patients alike, and it's a positive, inspiring place to be. So I would certainly encourage anyone at least to look into it and see what it's all about. And as I say, I'm happy to help. If anyone's got any questions, you can reach out to me. My website is www.lifemedonline.com, and I'm on Instagram at Dr. Adam Smith. That's at Dr_Adam_Smith, and also Instagram at LifeMed Community as well. If you reach out there, I'm very happy to speak to people, talk more about lifestyle medicine and advice that I can offer through there. So yes, that's me. That's my summary of what I've been up to and lifestyle medicine. I hope you found it useful.
So I hope you enjoyed the video. Thanks for watching. If you did enjoy it and you want to see more, then give it a like and subscribe to the channel. I'll see you in the next one.